Hello, I'm Dr. Barry Pakes, York Region's Medical Officer of Health. While the Omicron variant continues to spread, causing increased hospitalizations in our region and across Ontario, we're beginning this week with some hopeful indications that our efforts at vaccination and public health measures are succeeding. One of the measures we're now using to assess the intensity of COVID-19 in our region is COVID-19 signals in wastewater. The most recent wastewater signal suggests that we may be reaching a plateau of cases. This finding agrees with our forward-looking models that show our COVID-19 cases peaking this week or next. So while we continue to face challenging times, we can be reassured that our hard work and sacrifices are bearing fruit. Another good news story is schools. This week, children in Ontario returned to in-person learning, snowstorm notwithstanding. As we've seen over the past weeks, there's a broad consensus among public health practitioners, healthcare, community members, and politicians that a return to in-person learning is in the best interest of the mental, social, and physical well-being of our children. School is the best place for children right now. That said, the return to school may be worrisome for some parents. New provincial guidelines means that cases will no longer be reported in schools and cohorts will not be dismissed, so parents are understandably concerned. However, new provincial screening guidance, as well as distribution of further rapid tests for symptomatic children, will help keep COVID-19 outside of schools to the extent possible. The most important thing families can do to protect their children and themselves is to get vaccinated. While the risk of severe illness due to COVID-19 is low in children, the risk is much, much lower in vaccinated children. In York Region, well over half of children aged 5 to 11 are vaccinated with at least one dose, and over 90% of 12 to 17 children. And I'm hopeful that we'll be at 10% with second doses in that younger age group by the end of this week. One common area of confusion and controversy is when to get your vaccine if you've recently had COVID-19. You can safely get vaccinated as soon as you're feeling better and your isolation is complete. However, there is some evidence that waiting 30 days following your symptoms to get your next vaccine dose may provide more long-lasting protection. However, given that many people with symptoms haven't had access to testing and will not know definitively that their symptoms are truly COVID, it may be prudent to seek vaccination sooner rather than later. Again, thank you to our residents who've been adhering to the modified Step 2 regulations. These restrictions have had an impact on our hospitalizations and ICU admissions and are very important to our healthcare system and to meeting the challenge of this surge of Omicron. I look forward to sharing more positive news with you in the future. Please stay safe, remain home if you feel ill, and get vaccinated.